You are now a CAM follower. You're on episode 2. So thank you for joining us. Today we are going to be talking about how to identify chronic pain, why it's important, how you can have a more structured approach to identifying chronic pain. So when I met Gwen many years ago, she said something that keeps it really simple, and I'd like to share that with you. It's about change. It's about change in behaviour, change in posture, change in physical appearance, change in capability and gait, movement. So I'll leave you to explain that.
I think the main thing to think about, a lot of people say to me, my dog can't be in pain because it doesn't cry out.
Yeah.
Or it doesn't
whimper.
Or sometimes it doesn't limp.
Mm.
But I think if your dog was to run in front of a car and get hit by a car and it run off on 3 legs, you'd know he was in pain, yes? That's acute pain.
Yeah.
So chronic pain's not like that. Chronic pain's built up over time. So and if you think about maybe yourself, hopefully not, but your older relatives that have chronic pain, possibly arthritis, or many people have low back pain. Do you go around all the time crying and whimpering about it? No. You get on with it. You might move slightly differently. So you might get up out of a chair looking stiff.
Yeah.
Especially if you've been sat in a chair for a long time.
You might be hunched when you might move initially.
When you get out of bed in the morning, you might sort of maybe groan a bit and just push yourself up awkwardly.
Might be a bit moody.
Have you seen that in your dog before?
Yeah.
And so they don't go around crying about it and whimpering. Occasionally, if it's really bad and there's sort of an acute on chronic flare up, they might actually cry out or whimper if they get a short, sharp shock of pain. But most of the time, they're not going to
I've got great facts
complain
for
about
that.
it.
So the World Health Organization suggests that 1 in 5 people worldwide has moderate to severe chronic pain. 1 in 5. So when you go out for a walk today and you count every 5th person, see if they limp and see if they whine. Because humans manage chronic pain the same as dogs do. We get on with life because we have to. We have to pay our mortgage, we have to take the kids to school, we have to make dinner. So you manage chronic pain, but sometimes it just becomes too much to bear. So what we're trying to do with this episode is help you identify the signs of chronic pain earlier. But I think before we just go there, let's just tell them the difference between acute and chronic pain so they can understand that there is a very big difference.
Yeah, so I think acute pain really is designed as the body's emergency strategy. It happens after an acute injury or maybe surgery.
Yep.
And it's designed to remove, so if you were to burn yourself, you would quickly remove your limb, your arm from the heat source. It's designed to protect the body. It's designed to get you to rest or run away. We talk about fight or flight.
Yes.
So pain is within that mechanism of fight or flight, so run away from the danger source. Chronic pain's quite different. As it's happened over time, some interesting things happen in the brain and spinal cord to actually sometimes even wind that pain up. But it's completely different. It's not really designed to protect the body as such. And so there's different mechanisms involved and we have to treat it differently as a result.
And that's really difficult for owners, be you ownering your own pain or managing your pet's pain, because pain, you imagine it to be an ouchy kind of overt sign. However, chronic pain, also known as maladaptive pain, is very different, and you have to learn to live with it. And that's why we want to help you start picking up on the signs. Now, the reason that CAM was created many years ago was because as a vet in first opinion practice, and I'm sure any vets that are watching this channel can relate to this, the dogs that were being brought in too late, the cats that were being brought in too late. And by that I mean that they'd actually endured pain for so long that they'd lost muscle mass because they didn't want to move. They couldn't walk because they hadn't got up for so long because it was too painful. But the owners weren't bad people, they just hadn't realised. So there is a real big problem in small animal practice at the moment where chronic pain isn't identified early enough. And it is a leading welfare concern for small animal practitioners. Dental disease, obesity and osteoarthritis is big welfare concerns. So through frustration of one day having to put 2 dogs to sleep in one afternoon, which wasn't uncommon, I realised that people really didn't know how to identify this disease early enough. And that's what we're going to help you to do now. So we talk about the CAM factor, not the X factor. We talk about the CAM factor as a way to help you guys. So starting with the diagram that you can see here, at the top is behaviour change. To the left is posture change. Below is physical appearance changes, and to the right is capability and gait changes. Now, I know as a younger vet, I tended to wait for capability and gait changes. I tended to wait for the dog to be lame. I tended to wait for the dog to show disability. But now, with what I know, I realise that I could have identified these cases a lot earlier through behaviour change. What do you think about that?
Yeah, I think you're already quite a long way down the line by the time they start making really significant changes in the way they're walking or running.
Yeah.
So behaviour change might include they usually get up to greet you when you come in the house with great excitement, but actually now you're going into the house and it's taking them a few seconds to come to the door to greet you.
Yeah.
Maybe they don't bring you a toy to play spontaneously in the evening when you're trying to concentrate on the telly.
Yeah.
And they want your attention, but they're happy to just go and lie in their bed and keep themselves to themselves. There are other things that can cause these sort of behaviour changes, but it's a change in what was normal for them.
Yes.
Going up the stairs.
We had a lady who contacted Cam to say thank you so much because her dog had, well, what she believed, just aged, just got old, just changed because slowing down. And by watching our In Silence video, which I hope you will go and find within the channel, she'd watched that and she came onto the Cam page and she started her dog on pain medication, and her dog started doing helicopter tails again when he greeted her. So she hadn't really noticed that. She hadn't realised that had stopped until it started again. And that's quite common, isn't it?
I think, because if you see your dog every day,
yeah,
then you don't notice some subtle sliding changes. And sometimes it takes maybe a friend or a relative who hasn't seen you and your dog for a while to notice that something's different. And I often do that when I go home to see my parents. And I'll say, she's looking a little bit stiff today, or she's looking a bit off, she's not her usual perky self, and they've not really noticed the change.
No, I agree totally. And there's things that I look back before I started Cam in 2016, of all the cases that I could have helped. So I'd been a vet for about 12, 13 years by that point. And I can remember owners coming into me and saying, he doesn't tend to use his tail so much anymore. And I didn't know. And I would have said, well, I wouldn't worry about it. There's nothing that I can see that's wrong. Or they might say to me, he wobbles on his legs every now and then. And I'd be like, I've had a feel. No pain response. Oh, he's okay. Now that I know more, I sit there and go, what was I doing? So, just so we can keep these episodes short, sweet and digestible, I'm going to go back to CAM factor, guys. So CAM factor, behaviour change, posture change, physical changes, so coat changes, muscular changes, pad changes where they've tried to walk differently because they're trying to offload, nail changes, collapsed digits, knees facing the wrong direction, all these things, arches of the back, low neck carriage, big mane, capability and gait changes, wobbles, trips, stumbles, hesitations. A dog that used to jump on the sofa with ease now pauses, stutters, not quite sure, maybe even misses, has to pull themselves up. These are signs of disability, and behind disability is potentially pain. So what we suggest to you is think of CAM factor, look at what your dog's doing. If you're ticking 2, 3, even 4 of those circles, you need to have a discussion with your vet. And a little tip, take in the picture, write what you're seeing next to each of those 4 circles so that you can present to them a case of, this is concerning to me because I've had this. I'm concerned that this could be pain. Would you add anything to that?
No, I think that's pretty conclusive. Lots of things, go with some information for your vet about what you've seen change. Don't expect them to find pain in the dog on the consult table, because that's exactly where they won't find the source of the problem. They're totally reliant on your description of what's going on.
And video clips. Everybody's now got videos on their phones. And a big tip, I don't assess dogs on tables now.
No, I don't put dogs on tables either.
No, because what they do is they go, I'm just not going to move and it'll be over and done with quite quickly. And thanks.
The vet can have a situation when they're trying to examine your dog and the dog's behaving like everything hurts or everything is a disaster or everything is terrifying because actually they're terrified. So I will always leave dogs on the floor. In fact, I invite them into my consult room and I say to the owner, take the lead off, and I let him walk around for a bit before he even gets an examination from me, because actually I want to know so much from you, the owner, that actually physically examining the dog is only a really small part of my consult.
We're going to see you for episode 3 to give you a load of tips of what you can do when you visit your vet with that concern that you've got the first signs of arthritis. So we'll see you for episode 3. See you later.